For centuries, medical astrologers have operated on a singular, fascinating premise. Human biology is a direct, physiological mirror of the cosmos. At the center of this cosmic map is the sun. In astrological anatomy, the sun acts as the body's ultimate engine, governing our core physical vitality and the heart itself. This diagram illustrates what happens when that engine meets resistance. When the sun forms a hard aspect, a mathematical clash of planetary energies in a natal chart, two celestial bodies lock into an angle of severe friction. To a medical astrologer, this planetary clash is a literal biological stress test. The celestial geometry maps out exact points of physiological weakness, triggering highly predictable breakdowns inside the body. By tracking these mathematical angles against the position of the sun, a natal chart becomes a highly specific diagnostic map, pinpointing exactly how and why a cardiovascular system might fail. Take the conflict between the sun and Mars. In medical astrology, Mars governs the blood, intense physical activity, and vital minerals like phosphorus. When Mars clashes mathematically with the sun, that intense energy drives the human body past its physical endurance limits, causing immediate spikes in blood pressure and highly irregular heartbeats. This animated cross-section shows the start of the biochemical cascade. The planetary friction rapidly depletes the body's supply of magnesium, essential for regulating muscle contractions. Starved of magnesium, the adrenal glands panic. They hyperfunction, aggressively overproducing hormones to compensate. In a desperate attempt to balance this chaotic overdrive, the pituitary gland at the base of the brain drastically slows its own hormone production. With the endocrine system entirely out of sync, calcium absorption misfires. Instead of fortifying the skeletal structure, the calcium bypasses the bones and pools dangerously inside the urinary tract. This pooling creates an environment for kidney stones, triggers a hyperactive thyroid, accelerates bone density loss, and completely wipes out the body's reserves of vitamins A and D. This source text details these exact outcomes, linking the Sun-Mars aspect directly to severe cardiovascular ailments, high blood pressure, and sweeping mineral deficiencies. The Sun-Mars clash literally burns the physiological system out from the inside, leaving behind an anemic, enlarged heart that struggles to pump blood through an exhausted body. Contrast that burnout with a clash between the Sun and Jupiter. Jupiter is the planet of massive expansion, physiologically governing fat, cholesterol, and the liver. Jupiter's influence takes normal biological functions and inflates them into wild extremes, turning necessary nutrients into toxic overabundances. In this diagram, we see how the Sun-Jupiter conflict triggers a massive spike in cholesterol, overwhelming the bloodstream with dense lipids. Because the blood is saturated with these fats, the body is completely blocked from assimilating vitamin A and zinc. Zinc is crucial for clearing out fatty deposits. Without it, those deposits grow unchecked, which then throws essential B-complex vitamins entirely out of their natural balance. Left to accumulate, the arterial walls thicken and harden into severe atherosclerosis. Our source text confirms Jupiter's domain over this process, explicitly listing cholesterol-related degeneration and arterial issues under the Sun-Jupiter aspect. While Mars destroys the heart through frantic exhaustion, the Sun-Jupiter aspect suffocates it under the heavy weight of biological excess. A hard aspect on an astrological chart acts as an ancient early warning system rather than an inevitable medical outcome. If a chart reveals a Sun-Mars aspect, the prescription is straightforward. You must force yourself to physically recuperate and rest long before your adrenals fail. For a Sun-Jupiter aspect, the intervention requires proactive blood tests to monitor zinc, magnesium, and vitamin D levels, catching atherosclerosis before it hardens the arteries. Modern endocrinology proves these cosmic links. This Society for Endocrinology press release demonstrates the connection between the sun and heart health. The trial found vitamin D blocks a cortisol-producing enzyme. Lowering these stress hormones improves cardiovascular health and drops blood pressure. Whether mapped by a medieval astrologer's chart or a modern scientist's clinical trial, the biochemical link between the sun and the human heart remains an undeniable reality.